Ultrasound has some uses. A CAT scan can show some of the things that an MRI can. Again, we've had this situation come up. We don't always find it helpful to read other people's studies. We've done it in certain situations. The technique that they use may not allow a proper interpretation, but sometimes it can be helpful. So that's the type of thing that we should probably talk about on a consultation if you reach out to us. In general, as general questions, again, not to you personally. Ultrasound is real time, so you can watch things move. It doesn't separate the nerves and muscles great. It doesn't show really the costoclavicular interval very well because the bone shadows the ultrasound. It does show blood flow very well, but if you have neurogenic TOS, the blood flow is less important. Even complete compression of the vein doesn't mean you have neurogenic TOS. So ultrasound is somewhat helpful, but it has to be done in the right hands. It's much more sensitive to the technician performing it. There's this huge degree of difference between beginners and experts, and even experts may not be expert in TOS. So you'd really have to find the right person or the right clinic. A shout out to Johns Hopkins. They do very detailed vascular ultrasounds there for TOS under Dr. Yingwei Lum's direction. However, it's not always the answer in neurogenic TOS. CT scans that you brought up don't show the soft tissues nearly as well as an MRI. And a lot of soft tissues cause these problems in TOS. We hear about cervical ribs, but I'd say less than 1% of our cases have surgical ribs. And it's the soft tissue abnormalities that are much more important. So MRI is better for that. CT does show the bones very well and the arteries and veins very well. Very stark, white, clean, and clear. So it's easier for a surgeon to see because surgeons don't see as many cases as I do, and they don't see all the little shades of gray. That's my job. But it doesn't show the soft tissues as well. So each one has some advantages. CT you have to use radiation for, so we tend to shy away from that because it uses radiation and because it doesn't show the soft tissues as well, including the brachial plexus. So I hope that's a start.